We are Black American members of the National Academy of Medicine,
the premier health science organization in our nation.
We are scientists,
physicians,
healthcare professionals,
and public health experts.
We are also sisters,
mothers, wives, and daughters.
We are brothers,
fathers,
husbands, and sons.
We are your neighbor, the person in line at the grocery store checkout, the person sitting next to you in church. We are members of the Black community.
Many of us have fought our way into healthcare professions specifically to care for our community.
Many of us have devoted our careers to exposing racism in healthcare.
All of us have focused our careers on improving health for all.
That is why we support the COVID-19 vaccine, and we encourage you to get vaccinated.
Trust in government does not come easily for our community. Too often our health has been ignored and even abused.
It is not surprising that polls show that many Black Americans are hesitant to get vaccinated.
We understand why.
But COVID-19 is very serious.
And it has a devastating impact on our community.
We have come through so much over the years.
Now we are facing another life-threatening challenge.
We must do what we have always done.
We must choose to do what is necessary for our community's survival.
As health professionals, we understand the science.
As members of the Black community, we understand your distrust.
We have reviewed the research.
Some of us have participated in developing the vaccines, designing the studies, and monitoring the results.
And we are confident the research was done correctly.
Many of us have already received the vaccine.
The rest of us will get it when our turn comes.
We encourage you to claim your place in line to get vaccinated.
Do it for yourselves.
Do it for your loved ones.
Do it for our community.
Do it because we should not tolerate one more preventable death.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Trey Taylor.
Good Wednesday afternoon to you. I am Trey Taylor, and you are watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. It's Wellness Wednesday from In It Together SC and the Diabetes Advisory of South Carolina, and it is Minority Health Awareness Month. And Vince Ford, Senior VP with Prisma's Community Affairs, joins us today, along with Lee McElveen. She is the Hispanic Program Consultant with Alpha Behavioral Health in Camden. Thank you both so much for joining us today. I look forward to the conversation.
Thank you so much for having
me. Thank you.
Absolutely. Plus, a little bit later on in the program, DHEC Assistant Epidemiologist Jane Kelly joins us at the end of the show to give us an update about the J&J vaccine pause and the new mass vaccination site at Columbia Place Mall in Columbia, South Carolina. That and more next on Coping with COVID. But first, your COVID community updates. Speaking of that mass vaccination site at Columbia Place Mall, it is open 7 days a week from 7 a.m. until 7 p.m. Now, anyone 16 and over can get the vaccine, the Pfizer vaccine, walk in or drive up. No ID, no appointment is required, and Spanish and sign language translators are on site. Now, the FEMA DHEC collaboration is aimed at providing as many vaccinations as possible to the underserved population. The J&J vaccination has been placed on hold. This after several females acquired blood clots several days after taking the one-shot vaccine. Those affected are between the ages of 18 and 48 and are the only ones reported to have the problems of the 6.8 million doses administered. Now, DHEC Assistant Epidemiologist Jane Kelly, as I said, joins us later to discuss more about the vaccine and what to look out for if you, like me, took the J&J. USC has announced a collaboration with the National Soccer League today, making the state an official education partner. Now, this will give current, former, and esports players online educational opportunities, academic resources, and personal and professional development, specifically designed for the needs of professional athletes. Now, MLS in turn will provide exclusive learning opportunities and experiences to both USC students and several community-based initiatives. SCDHEC has your most up-to-date list of times, dates, and location for COVID vaccinations, tests, and flu shots. Visit scdhec.gov for more information. Now, if you do want more information about testing, GoGetTested.com is an easy online resource for you to make an appointment, find out a location in several states, and get your results in 48 hours. The DHEC Care Line is also still open and available for you to get information about testing, vaccines, organizing a COVID screening at your event or in your neighborhood, and transportation to get a test or to get a vaccination. Now, speaking of testing and transportation, if you live in Richland or Clarendon counties, paramedics there offer in-person COVID screening. Call 911 for more information. Now, we mentioned it in the news segment that the Columbia Place Mall's vaccination clinic is open 7 a.m. to 7 p.m. 7 days a week. You can go 16 and older. No appointments are needed, and they do have Spanish and sign language speaking translators on site. That's at Columbia Place Mall. COVID vaccines are also going on at Lexington Medical Center. As a matter of fact, some of their locations have gone from appointments to walk-ins, including the one at the Lexington Medical Center and the auditorium there, and the one at Brooklyn Baptist Church. Now, if you are a vet, the VA is handling all veteran vaccinations. All you have to do is call the VA, and they'll get you set up to get your vaccination. Several retail outlets are offering vaccinations. Also, Kroger pharmacies are offering the COVID vaccination. Check the screen for details. Also, CVS pharmacies are offering COVID vaccinations, and the CVS pharmacies inside Target stores are also offering vaccinations. Now, if you or someone you know is a senior citizen and having some challenges registering for your vaccination and would prefer to register than to go to one of the walk-up sites, you can get information and help from Get Set Up. Get Set Up can help you make your COVID vaccine appointment and more. You can call Get Set Up. That information is also on the screen. Now, don't forget, you can get free transportation to get your shot from the Comet. Don't miss your shot. Catch the Comet to get your vaccine. The Comet bus system is also going to offer at the end of the month a vaccine location at the Comet bus station on Laurel Street. So again, don't miss your shot. You can catch the Comet. Now, Richland County Rental Assistance Program is open. It opened this week. If you need some help with your rent and also with your bills, visit richlandcountysc.gov for more information. The NAACP's Housing Assistance Program is still going on. They're giving help to landlords, mortgage companies, and tenants. You can see information on the screen about the NAACP Housing Navigator program. The South Carolina Bar Association and SC Legal Services also have collaborated for a toll-free number and website for rental and mortgage help. And the City of Columbia is offering a 6-month payment plan for water bills. You can even get payment assistance up to 75%. If you need help with the online work and school, Rashonda Pratt's YouTube channel is still up and going. Don't forget to subscribe to that and get the information you need. And the Affordable Care Act, Obamacare, open enrollment has been extended yet again through August 15th. Rosalind Goodwin with the American South Carolina Hospital Association is going to join us next week to tell us about the additional tax credits you can get, that even if you have already gotten your insurance, you may want to log on again to see if you can get even more tax credits than before. Finally, the Black Lives Matter Scholarship Fund is still taking applications for African Americans in need due to the pandemic. They are giving special consideration to those in the transgender community, single parents and guardians, and those who are formerly incarcerated. Again, that information on the screen. If you need more information, please check it out. Coping with COVID presents Wellness Wednesday from In It Together SC and the Diabetes Advisory Council of South Carolina. Listen, if you are interested in a diabetes prevention program, check out the In It Together website and Facebook page for more information. Don't forget also, coming up, your chance to get a copy of the Dash for Good Health Southern Soul Cookbook. This is the book. It's amazing. These are great Southern style recipes that have a little healthy twist. Food's still good. It's just giving you more health advantages. All you have to do is put in the chat that you would like the book, put in your email address if you would like, and we'll have someone contact you about sending your prize. Coping with COVID is streaming live on the TaylorMade Production Facebook page. Please go over there, hit like, follow, and share. So not only you can watch Coping with COVID, you can get all of your COVID-related updates that we post throughout the week. We're also streaming live on YouTube. I want to say hi to all of you YouTubers. Thank you so much for watching, and please hit the subscribe button. Now, additionally, we're also streaming live on the In It Together Facebook page. Again, visit the In It Together Facebook page for more information about a diabetes prevention program. Now, Dr. Damon Tweedy will be the guest speaker at the South Carolina Chronic Disease Symposium. This is his book, Black Man in a White Coat. Did you check him out a couple of weeks ago? This is a doctor's reflection on race and medicine. He's going to be the guest speaker at the South Carolina Chronic Disease Symposium. It's going to be June 3rd through the 5th virtually. And if you would like to register for the conference, if you do that by April 23rd, while supplies last, you get a complimentary copy of his book. I want to say hello to Renee Nelson. She says, good afternoon, everyone. Hello, Renee. Thank you so much for joining us on Coping with COVID. Deshauna Chanel asks, how are we doing today? Hey there, darling. Thank you so much for asking and for watching Coping with COVID. We appreciate you watching Wellness Wednesday. I want to remind you to please post and share this information out as always, because we are getting the message to the masses about a myriad of great topics that people need to hear about. Now, it's Minority Health Awareness Month. Vince Ford joins us. He's VP of Community Engagement at Prisma Health. We're also joined by Lee McElveen. She's the Hispanic Program Consultant at Alpha Behavioral Health in Camden. Thank you guys so much for joining us today. We appreciate it.
Thank you so much, Trey. We appreciate you.
Absolutely. Thank you, Vince. Thank you so much.
Thank you. It's a pleasure.
Thank you, Lee. Thank you so much. Listen, COVID, I think, among a lot of other occurrences in recent history, has really shone the light on the health disparities among Black and Brown communities. And I want to discuss that a little bit later. But even before that, there were concerns in the minority community about health disparities. That's why minority health awareness is so important. Lee, what were some of those health concerns for the Hispanic community?
Yeah, I think, with the Hispanic community, one of the biggest thing was access to health care. And not being able to access healthcare. It could be for many reasons, not having insurance, cultural barriers, language barriers. So that in itself made it hard for the community, to receive help. And typically with the Hispanic community, along with, I think, other minority groups, preventive care is something that is not really sought out. We go get help when we probably already in the stages of a disease, or so preventive care is something that is not, that we need to work on in our communities.
Why is that, Lee? And I'm asking because I think a lot of people have heard more about the concerns that African Americans have had,
I just think it's cultural issues, cultural challenges that through the generations are passed on. You try to naturally take care of whatever it is that you are experiencing, use natural remedies. You just go if you absolutely tend to. Sometimes you end up going to the ER, you haven't been feeling good for a long time. And then too, the lack of insurance, in a lot of places, insurance is not the way it is here in the United States. And also the delivery of services in their country of origin may have been very, very poor.
Yeah.
So when our Hispanic community enters into the United States, a lot of times they're not familiar with how the U.S. system works. So there are many components to why I think in the Hispanic community people don't receive care, preventive care.
Right. Are there underlying health conditions in the Hispanic community like there are in the African American community?
Yes, there are. In fact, we would say that heart disease, diabetes, a lot like the African American community, obesity, hypertension. These are some top conditions among the Hispanic community that are very prevalent.
Vince, it sounds like from what Leah's describing, the Hispanic community is experiencing a lot of what the African American community is experiencing as far as health concerns disparities.
Absolutely, a lot of parallel issues. I mean, I was going to start off by saying all of the above. Everything he says, I agree with, and I would add some additional things. Health disparities have always been a major issue in the African American and now in the Latino community as well. And a lot of reasons for that. We know about the social determinants of health, from access to care to the fact that a lot of people work jobs that they cannot get off of or they can't afford to get off of. But in addition to that, there are the issues of medical mistrust, where the community does not trust the healthcare system because of all the historical things that have occurred. And some people try to write those things off, but they're real and they're still present. And you can look at even most recently with COVID, the life expectancy in the African American community has decreased, which is really interesting, by a year or two. And so there are a lot of concerns. I know at some point we're going to talk about personal responsibilities. I don't put all of the responsibility on the system, because one of the things that we need to do doing this show and other shows is share about personal responsibility. Take the responsibility to make sure that your own health is good and that you can get the help and care that you need.
Yeah, and you're right, and we are going to talk about that more, because you're right. There's nothing like you gotta take. That's just being a grown up. You know, you gotta put our big boy and big girl pants on at some point and recognize that we are responsible for our own everything. The system is going to be what the system is. The world is going to be what the world is. We've got to be able to take care of things we can control, and we can control us. You know, we're talking to Vince Ford. He's a senior VP of community affairs at Prisma Health. Lee McElveen also joins us. She's a Hispanic program consultant in Alpha Behavioral Health in Camden. Vince, are there specific ways in each community to address those needs and issues? I'll start with you first.
Oh yeah, absolutely. And the thing that we have to recognize is every community is different. And so there are some neighborhood association issues that can help in certain areas. So yeah, it is different. But here's what we know, going back to the previous question, about 15 to 20% of good healthcare comes from a healthcare system. So if we want to try to get people to what I call a sweet spot of health and wellness, health and well-being, going to the doctor when you feel pain or discomfort is a good thing, but that only represents about 15% of your ability to stay well and to get good care. But there's some other things: getting a good education, making sure that there are no environmental issues, making sure that you're eating appropriate foods, making sure that you're not living in a stress or crime-free community, making sure that your community, from which your elected officials, have sidewalks and that they are controlling stray dogs, believe it or not, which has been shown as a factor to keep people from walking. So there are some things that can be done to help in respective communities. Certain communities don't have those issues. Other communities do. We've got to work on those things collectively.
Right. And again, it goes back to you can control that by the choices that you make. You make such great points about straying it away from even health, but like you said, education, making sure you're actively involved in the upkeep, the appearance, everything as far as your neighborhood concerned. Those are things I think that we don't think about when we think about health disparities in our communities. Lee, is the medical community addressing the specific needs of the Hispanic community?
What I have seen is that throughout the years, there are greater efforts for the medical community, clinics, different programs to address the needs of the Latino community. For example, I am seeing more that medical centers are putting in language access plans. They are trying to hire people that are bilingual, but not just bilingual, but also bicultural, that they understand the challenges faced in the different cultures. So I have seen a great improvement in trying to meet the needs of the Latinos. Of course, nothing is absolutely perfect, but through the years that I have worked with the state, at the national, state, and local level, I have seen a lot of changes. And people as a whole are trying to meet the needs of the diverse communities.
Do you think that there's a clear understanding, though, in the medical community what those needs are? And can you tell us some? And I know you mentioned the language barrier as being a big thing, but do you think the medical community recognizes what they are?
I don't think that there is a complete clear picture of what all the needs are. I think we need more programs where people our medical interns or those people doing internships or fellowships or whatever, that they can kind of get immersed in the cultural settings so that they can learn a little bit about these challenges, cultural issues in working with the Hispanic patient or Hispanic client. And you know what? That doesn't happen overnight. It takes years of experience, in the medical field. And those, for example, in places where the Hispanic community, there's a large concentration. Well, of course, you have medical doctors, you have clinics, hospitals have more experience in working with the community. So therefore, over the years, they can apply what they've learned personally.
Right. That's Lee McElveen with the Alpha Behavioral Health Center. She is the Hispanic coordinator consultant there. I know you're watching Coping with COVID Wellness Wednesday in It Together SC and the Diabetes Advisory Council of South Carolina. Thank you so much for joining us. Please continue to post and share this message out so we can get the message to the masses. I want to say hi to everyone that's joining us. Vince Ford also joins us. He is Senior VP of Community Affairs at Prisma Health Fair, at Prisma Health. And how has outreach changed? And Vince, you've been in the game a long time doing outreach and community involvement for a hospital system, of course, Providence, Prisma Health. How has outreach changed as far as, targeting minorities?
So that's a great question. And it has changed. I think if you go back decades ago, the community had to come to the hospital. Now there's a process where we're actually going out to the community. That's number one. Number two, I think that we've had to adjust to make sure that we're out in the community when the community wants or needs us.
Right.
And then number three, we have to make sure that we're accessible. So even with COVID, for instance, we're taking our mobile unit down into the community in different places where access to care is a challenge, is more difficult. And we've got to do it on some of those non-traditional times, like on Saturday mornings, rather than doing it during the week. And sometimes even Sunday afternoons. And as I heard you talk about or you will talk about the clinic that's at Columbia Mall, they're going to do it 7 days a week.
7 days a week, yeah.
Yeah, I applaud that. And so things have changed. The other part is we understand that there's some things that matter in the healthcare space that may not have anything to do from the naked eye with healthcare. For instance, housing. Yeah. Housing is critical to a person's ability to be healthy and well. And healthcare systems have to get involved with housing, with transportation, with food deserts, et cetera. I could go on and on. And so things have changed over the years where we now have to be responsive to the community. The other thing is healthcare systems have to understand that they cannot operate in a silo, that they have to partner with different entities. The faith community, which is one of our favorite partners, and because of their ability to recruit, attract, and help people in their communities get the health care that's needed. Most churches have a health and wellness committee.
Yeah.
And so using them, using K-12, using colleges and universities, the business community. Another key partner would be neighborhood associations. They've been critical to our ability to provide healthcare throughout our communities.
Yeah. Lee, is there a kind of a parallel to what Vince is saying? Because in the Black community, it's the church. What is it in the Hispanic community that's important to connect the community with healthcare?
Yeah, I want to go back to, I think Vince mentioned this, talking about trust issues.
Yeah.
Among, the community in terms of, education and so forth. And I think with the Hispanic community, yes, faith-based plays a big role, but also the trust issue is who are the leaders of these communities that people have been able to trust and know that, okay, they're not going to harm us, they're not going to hurt us, they're here to help us. And I think we also need to make sure that we understand that when we talk about Hispanic, we're talking about different groups of people in terms of their status. Because you have your Hispanic Americans that have their own challenges, different generations that are here, and then you have the immigrant community, perhaps those that are undocumented. So we're talking about a big group of people that all have their own set of challenges, in spite of the language barriers, cultural barriers, etc. But yes, there's so many parallels with what Vince has just shared with us, with the Hispanic community. But I also think that our social media has had a big impact in the way we do outreach, especially with COVID. Because believe it or not, unlike the perception that maybe a lot of Hispanics don't have access to cell phones, they don't have access to being able to communicate through social media, that is an incorrect assumption. In fact, social media has helped us reach out to a lot more people that we probably typically would have reached. It may not be the one-on-one, but we're getting the message out. And also we have what we call promotores. It's a term that's used in terms of training people, healthcare, community workers. In the Hispanic community, you train people that live in the community to get the message out, whether it be diabetes, prenatal care, or whatever. So we use a lot of the promotores in our community, and I believe in the African American, the same thing. We do.
Well, you made a couple of great points. I want to mention one, that the community is not monolithic. You hear us say that a lot in the African American community. It's just not you Black and you all lumped into one thing. You said there are several different. You said there's just several different groups. And so I think that is another thing that healthcare has to be made aware of, conscientious of, that you have to use different approaches for different segments of the community, so to speak. And I'm glad that you mentioned the outreach, because I was going to ask you, are there enough Hispanic, Spanish-speaking people in healthcare to even help make it more comfortable, for that community?
Well, and once again, it depends where we are looking, the demographics, our counties, our rural areas. I will tell you the truth, truthfully, in our rural areas, we still have a real big gap in finding interpreters for agencies. Like you may have a lot of farm workers in one area, but finding an interpreter in that area, or even a Hispanic leader in that area, is very difficult. But one thing we've learned, if there is a Catholic church, let's say, in that area, a lot of times they have Spanish Mass. So that will be a good connection to try to work with the church in terms of maybe getting some information out to the community. But in terms of, Hispanic physicians, Hispanic nurses, counselors, mental health counselors available, there is still a need for more bilingual, bicultural healthcare workers.
How do you tackle that?
I think incentives. I think the state can have incentives to bring people into our area through perhaps those that are looking for maybe help with their education loans. I think there are policy changes. I think there are many ways that we can probably bring more healthcare workers to our area.
So let me get this straight. You're not saying that there's a lack of Hispanics in the healthcare profession. They're just not where they're needed, maybe in some of the smaller rural communities. Is that what you're saying?
I think there's more Hispanic healthcare workers than there were years ago, like let's say in the 80s, okay? Because there's been a growth, there's been an increase, there's different generations. But what we're finding too, that you may have a Hispanic nurse, she's of Hispanic heritage, but guess what? She doesn't speak the Spanish language, okay?
Right, yeah.
So, you know, there's different things we have to look at in terms of what is available to us.
Yeah.
So there's so many factors, right?
Yeah. So such great points. That's Lee McElveen. She is the Hispanic consultant at Alpha Behavioral Healthcare in Camden. Vince Ford joins us also. He's with Prisma Health. Before we take a break, I want to ask about that personal responsibility that we hinted at earlier in the conversation. How does personal responsibility factor in minority health? Vince?
So there are a number of things that can occur and should occur. And I would encourage everyone in the listening audience to take control of your own health and well-being. Because here's what we found, Trey. Even when income and education is not an issue, African Americans still tend to have worse health outcomes. And so there's some things that we have to do, that we must do in preparation to, again, have a normal and healthy and well-being life. Number one, of course, we know about appropriate eating, but movement is a key thing. Even if you can't exercise, just move, get up and down. Don't sit down all day. Walk around the block, walk up and down the stairs. There's some things that you can do. Eliminate stress. And one of the ways you can do that is do something meaningful in life to help someone. Even if you're not getting paid for it, go out. That brings you tremendous health benefits. Be important to someone else. And then here's one that I'll say that is key, that has not gotten a lot of attention, but I would encourage our community to make sure that they pay attention to this, and that is sleep. Sleep is critical. I would recommend a book called Sleep Smarter by Sean Stevenson. It's a great book, but sleep is critical to this process. Stop waiting for people to take care of you. Start taking care of yourself. And, I'm concerned that, again, even when education and income is not an issue, we still have some of those health disparities. So we have to hold healthcare systems accountable for better outcomes for the African American and Latino community.
How do we do that before we get to Lee? How do we advocate for ourselves to the healthcare community?
So there are a number of ways. One is to start to have conversation with leadership about the data. Start to look at the data. Sometimes talking about something is one thing, but when you ask them to produce the data to show that that African Americans are having, or Latinos are having, different outcomes for some of the same issue. Here's an example. If you look at African American women, white women, and African women who are now living in America, African American women have more challenges in labor and delivery than the other two demographics. Now, there's some belief that it has to do with stress related to race and racism.
Right.
So there's some things that we need to discuss and some things that we need to do.
Do we, when we're advocating to our healthcare professionals, do we go to the Vince Ford Community Affairs Coordinator in each hospital system?
Yeah, we go to someone.
Yeah.
We start with obviously the leadership, but we look to online to see who's on the board and start to have some dialogue.
Gotcha.
We talk to our elected officials. We talk to key leaders, ambassadors like Lee McElveen and others to start a dialogue, and which is what we have to have. So we start with dialogue, but we don't end with dialogue. We start with dialogue, we look at data, and then we start to develop some goals to see how that's going to be turned around. Quick example, we started examining all African-American men who were coming into the hospital for COPD. And we found some things out that were different than any other demographic. And so we started to work on those after we started looking at that data.
Yeah, that's good. Community involvement, knowing who to talk to about what, and leave the barbershop or the beauty salon complaining about everything and come out, and go on your computer or whatever and find out who the people are that are change makers. Lee, where does personal responsibility lie in the Hispanic community? Is it the same or similar?
I think it's very similar. I think our Hispanic community, I think, and as I mentioned, depending on the generation, depending on how long they've been here, we cannot continually use excuses. That if we're going to be here, we cannot continually use excuses such as language barriers and so forth. We need to be proactive. Unfortunately, for example, with COVID, the Hispanic community is 3 times higher than other groups in terms of COVID. And we've got to learn to take responsibility, stay informed. The community needs to stay informed, ask questions, be able to be involved. And like Vince said, we need to start conversations with leaders to see how we can do a much better job in making sure that all, and not just Hispanic, but people that are here that perhaps English isn't their first language. And of course, I'm representing the Hispanic community, but there are other groups of diverse groups, like in North Charleston, the Asian community is growing very much so in that area. So we have to have these conversations because, we have standards in place. Office of Minority Health, U.S. Office of Minority Health has put what we call class standards, culturally linguistic appropriate services. You can have standards all day long, but where's the accountability for agencies in using these standards? So, we need to have conversations of how we can work together. It can't just be one person, one community leader. It's got to be everybody involved.
Yeah. When we come back, Minority Health and COVID, Lee McElveen, Hispanic Program Consultant for Alpha Behavioral Health in Camden, rejoins us along with Vince Ford, Senior VP of Community Engagement at Prisma Plus. Assistant Epidemiologist from DHEC, Jane Kelly, joins us. She's going to talk about the pause on the J&J vaccine and that mass vaccine unit in Columbia at Columbia Place Mall. Plus, don't forget to get your copy of the Dash for Good Health Southern Soul Cookbook and a Coping with COVID face mask. Place your name or email address in the chat and someone will contact you about getting your prize. I'm Trey Taylor. You're watching Wellness Wednesday from the South Carolina, the Diabetes Advisory Council of South Carolina and In It Together SC. We'll be right back.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Trey Taylor.
Visit Davis Tax Service today, 803-419-1001.
The Comet gives me a reliable source of transportation.
It's very convenient to me, and they have wonderful drivers.
It's clean, and it builds community. It's fun to meet people.
It makes me feel like really independent. It's just fun.
It's always going to be there, and it gets me everywhere I need to go.
We try to ride every single day. Comedy is our livelihood.
MUSC presents the 2021 SC Virtual Black Expo, Saturday, April 24th. Virtual guest speakers include hip-hop mogul Master P, gospel group sensation The Clark Sisters, financial educator Marcus Benjamin, celebrity stylist Sergio Hudson, and singer-songwriter Raheem Devon. Participate in a fitness session with Coach Nadia, a Jack Daniels cooking demo with Chef Monica, and a panel discussion with Black Food Friday creator KJ Kearney. For exhibitor booths and more information, visit our website.
Computers, they're a part of our everyday lives. But when they're not working, they're an everyday problem. So call Computers Unique, your everyday solution. 803-351-5821. Is your computer running slow? Won't turn on? Do you need a screen replaced? Or maybe you just need another computer? Well, Computers Unique is your one-stop shop for all your computer needs. They have a wide variety of new and pre-owned PCs, Macs, and tablets. So call Computers Unique, Dutch Square Mall. 803-351-5821. 803-351-5821.
COVID-19 has changed how we express our faith and gather to worship. We all want to get back to how we pray, how we congregate, how we lift our voices in praise. Now it's time to take the first step that lets us get back to spreading the word without spreading concern. Before we can safely come together, we need the facts. As COVID-19 vaccines become available, you may have questions.
Should I get it?
Is it safe?
Should I wait?
It's okay to have questions. Now get the facts. Learn more at getvaccineanswers.org so you can make an informed decision when vaccines are available to you.
Welcome back. You're watching Coping with COVID, updates on the pandemic and information to help you thrive and survive COVID-19. It's Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and In It Together SC. I'm Trey Taylor. And hey, don't forget that Dr. Damon Tweedy's book, Black Man in a White Coat, he is going to be at the South Carolina Chronic Disease Symposium June 3rd through the 5th. It's a virtual conference. SCDCAC is sponsoring it. You can get a complimentary copy of the book while supplies last if you go ahead and follow that link. The link is actually right there on the screen right now. Follow that link and register for the conference and get a complimentary copy of the book while supplies last. We are talking to Lee McElveen today, Hispanic program consultant for Alpha Behavioral Health in Camden, and Vince Ford, Senior VP of Community Affairs in Prisma. I see Jane Kelly is here, and we're going to get to her in just a little bit. But we've been talking about minority health awareness, and COVID was really the great equalizer, I think, last year, and also spotlighted the health disparities among Black and Brown people. I think we hear more about the African American impact, Vince, the elderly and the homeless. But Lee, how did COVID affect the Hispanic community health-wise?
Yeah, as I've mentioned earlier, COVID actually is 3 times greater in the Hispanic community than any other minority group. Unsure right now as to why that is, other than I can make possibly make some comments regarding the kind of the historical background in terms of healthcare and so forth. But it could be a lack of information, lack of getting information that they need in Spanish. In terms of vaccines, I don't have that data with me, but depending on the groups that I mentioned earlier, those that are here and are not here documented or don't have proper paperwork, they're not going to have IDs to go in line to get vaccinated because that is required. So there's different barriers that are there where that are going to make it difficult for those that do choose to get vaccinated.
Is there vaccine hesitancy among the Hispanic community?
I'm sure there is, because anything related to the government, there is mistrust. And so anything related to that, I'm sure there is hesitancy in our communities.
And what do you tell people? I know that you have taken a stance, and you can say it better than me, to just kind of pump the brakes a little bit on it.
Yeah, my stance concerning the vaccine at this time is I'm trying to get as much information as possible to stay informed, try to get the knowledge that I feel comfortable with in making a decision. And of course, that includes for me praying about it to see if I'm doing the right thing. We know what just came out with the J&J vaccine, that even puts more fear in people and hesitation. So my suggestion to people, this is a personal choice. You know, I have loved ones, family, friends that have done it, and others that have chosen not to vaccinate. So I just think becoming informed, and if you choose not to be vaccinated, to still take precautions as we've been taking all this time to stay protected and to stay well.
Yeah, Vince, we already know that there's been vaccine hesitancy among the African American community. How do you address, if not combat it?
Well, there is vaccine hesitancy. And I think, Trey, one of the things that we have been trying to do, working with all of our community, is to provide factual and good up-to-date information. Mm-hmm. I respect the fact that people sometimes don't want to get the vaccine, or they decide that they are concerned for all the reasons that Lee and others have mentioned, Tuskegee, medical mistrust. But what tends to happen is people are focusing primarily on the vaccine, but let's also give equal information on the virus.
Right.
The virus has killed over 530,000 people in America. And while there has been a little stoppage most recently with J&J, and that's like 1 in a million, the vaccine pretty much has provided a level of protection for people. But I respect anyone that has made that personal decision not to take the vaccine. If you go back to October of 2020, I was in the hesitancy category. And then I moved, as I started to study, I moved to maybe I will take it. And then I continued to study and listen to key people like Dr. Linda Bell and Dr. Jackie Jones and others. And then I moved to, I'm probably going to take it. And then it was the Saturday before Christmas. I was on the phone with my kids. One lives in Memphis, the other lives in Tampa. And we were having a family conversation about the fact that I said that unless they did certain precautions, they could not come home. And it was at that point that I decided, without a doubt, that if there was something that would provide me with a level of protection that would allow me to spend more and more time with my family, because time is limited, then I would go and do it. So I took both doses of Pfizer. I had absolutely no problems, no challenges. I'm not one of those people that just jump up and run and get a vaccine, or the sight of a needle will make me run in the other direction. But I took it with no problems whatsoever. So the more we talk about it, the more we inform people, the more we share. Well, Tuskegee, they withheld medicine. In this situation, we're providing medicine. Of course, there's some medical mistrust. The vaccine wasn't developed in a year. The vaccine has been worked on now for years, if not decades. I mean, we can go through the whole litany of things, but even with that, I respect people who make a decision that this is not for them. But what we try to do is provide information to people who want it, and here's what you need to do, and here's what you need to know.
Right. And we're going to get to Assistant Epidemiologist Jane Kelly in just a minute. I appreciate her joining us because she was in another event. But before we go, where can people get the information, Vince, about the vaccine, where it's being held? Because I know you guys are doing, Prisma is doing a lot, not only in all communities, but including rural communities, giving access to people who would not have it, because that was a big thing too.
So that's a very good question. And let me start with where not to get it from. Where not to get it from is off the street or from your friends and or your family members.
Lord, can you get it from your family members?
Here's where I think
I know
you
you
need.
get COVID from them because you get the vaccine.
Yeah. Here's where you, in terms of information,
Right.
DHEC is a very credible source.
Yes,
I would go on DHEC's website. I would go on CDC's website. And even after you get that information, sit down with your primary care doctor or a medical professional that you trust, and or your pastor, someone that you trust, and have a conversation about the facts, not the misconceptions, not that I heard or I believe, but the facts about the vaccine, and then make your own enlightened self-interest decision that's best for you and best for your family.
Yeah, that's a whole different conversation that we could have, because I am on that social media misinformation bandwagon. This was that way. And I've said this before to you on another platform, that this is what this show was aimed at. I launched it in March to help disseminate credible information to that audience who typically only gets their news and information from social media, just to provide some long form information that people can talk to and get answers from, real-time answers from leaders and experts in our community that they may not have access to. But so thank you both so much for joining us. Lee McElveen, Hispanic Program Consultant for Alpha Behavioral Health, and Camden Fitzford, Senior VP Community Affairs at Prisma. Thank you both so much for what you're doing in our community and for joining us today on Coping with COVID. I appreciate you both.
Thank you. All right.
Thank you, Trey.
Thank you. We're giving you updates on the pandemic and information to help you thrive and survive COVID-19. It's brought to you by In It Together SC and the Diabetes Advisory Council of South Carolina. I mentioned earlier that there is a mass vaccination site in Columbia at Columbia Place Mall. To discuss that and the J&J vaccine problems and pause, Assistant DHEC epidemiologist, friend to the show, Jane Kelly, joins us. Hey there, Dr. Kelly, how are you?
I am great. It's been a while since I've talked with you.
I know, it's been too long. You're sitting in the dark. Are you okay?
We have somebody working on some things out on the deck. So we've got like all the furniture that was out on the deck moved in. I have a light on. I don't know why it seems so dark in here. Here, I'll make it brighter.
Oh, you're fine. You're fine. I just want to make sure you're okay in there. So listen, let's get to it. And I want to start with the J&J vaccine, because I think that is really on top of people's minds, because I'm one of the 6.8 million people that got the J&J vaccine.
Mm-hmm. Along with my husband and my son.
Really?
Mm-hmm.
Yeah. I was like, one and done. I want to get it, over with. What happened? Why are people getting these blood clots? Because that's what's happening, right?
So there's a lot of unknowns right now. The reason we even know about this is because CDC has this special system in place, not just for this vaccine, but for all vaccines. And it's called VAERS. It's Vaccine Adverse Event Reporting System. So that doctors are required by law, if somebody got a vaccine and has within a couple of weeks of that vaccine has some event. It may not be related to the vaccine at all, but they want to know about it so that they can investigate it. So if somebody gets a vaccine, gets their tetanus shot, for example, and a week later has a heart attack, CDC wants to know about it so that they can look and see, is there some trend? Is there some weird thing cropping up? Otherwise, how would we know? I mean, there are almost 200 million doses of vaccine that have been given. Not just of Janssen, but of all the COVID vaccines. And, and here's 6 cases. So out of Janssen vaccine, that's 6 cases out of 6.8 million doses. Who would even know? It's not like they're all in one town or have the same doctor. They're all over the country. So they only know about it because of this reporting system. Now, the thing is about this reporting system is it is set up to pick up rare events. But that doesn't necessarily mean the rare event was caused by the vaccine. That's why they have to investigate it. And they're just playing it extremely safe. They're like, we can wait a couple of days and really look at these charts, try and understand, do these people have some underlying condition that they didn't even know about? That they didn't even know about, or what can we learn about this? And and I do want to echo what I think the folks you had on earlier, what Vince was saying about you have to, when you're weighing risks and benefits, you have to look at the whole equation, both sides. What's the risk of my getting vaccinated? What's my risk of getting COVID? And if I get COVID, what's my personal risk? You know, what am I older? Do I have a medical condition? Do I have
Right.
diabetes? What's my risk of having a more severe disease? But I want to mention specific to these blood clots. I mean, this is a rare event that they found, but COVID-19 disease actually gives you blood clots at a much higher rate. So this is 6 out of more than 6 million. So this is literally the 1 in a million rare event compared to, for having COVID-19, 165,000 cases of blood clots per million people who get COVID-19.
Yeah.
So I know it's good. I think it's good that they paused this. You know, you want to be extremely cautious. I think it's a sign the system is working to be cautious and find these rare events, investigate them. Maybe this is a vaccine that is not good for certain people. Can we identify who it is? Or maybe it's not related, or maybe it is a rare, you know, nothing in life is 100%. There's always going to be that 1 in a million thing. And I know that really unnerves people. But the truth of the matter, there's a 1 in a million chance of all sorts of things. You know, when you take aspirin, you know, if you're a person who didn't know you had, I'm going to pick G6pd deficiency, which sounds really obscure, but about 10% of African American men have this thing, and they don't even know it.
Really?
It's an enzyme problem that doesn't affect them in everyday life, but if they take a sulfa drug, they have a reaction.
Oh, wow.
So, you know, there are things out there where there are certain people that'll have a reaction where most people would not. I mean, every time we say 1 in a million, that means 999,999 others didn't have it.
So there wasn't problem with the science. This was just, as you say, a 1 in a million occurrence.
Well, it's good that they're looking into it. I think it's interesting that you've probably read about Astrazeneca, which we don't have in the United States, but they have in Europe, and they are having a similar problem with rare but real blood clot events.
And both of those are based on a similar science. Yeah.
Similar way of making a vaccine. Yes. And the thing is, that's a way of making vaccines that has worked for lots of other vaccines without this coming up. But once you start vaccinating millions and millions of people, you're going to find some odd, bad things.
This is Dr. Jane Kelly. She is assistant epidemiologist with DHEC State of South Carolina. So, Dr. Kelly, so there was a specific demo, 18 through 48-year-old, I think, women.
Yes, all women.
And again, that's a large age group and 6 women.
Right. So you think about the millions of people of women in that age group who've been vaccinated who didn't get this. So, I have to put it in perspective. And I know there are people who are worried, oh, I got this vaccine. What do I need to do? Well, you don't necessarily need to do anything. I mean, anyone who got the Janssen or Johnson & Johnson vaccine more than 3 weeks ago, all of these cases happened within 2 weeks. So if you got your vaccine 3 weeks or more ago, you're fine. You're vaccinated. You're fully vaccinated. That's great. You don't need to do something else. If you were recently vaccinated and experiencing problems, severe headache. I don't mean, the kind of headache you get the next day after being vaccinated, but I mean like migraine headache, sick headache, the kind of thing that would, you'd want to go to the emergency room for. If you have that kind of headache, shortness of breath, severe abdominal pain, those are things you need to go not only to see your doctor, but to let them know that you were recently vaccinated so that they can try and investigate further.
Well, I'll tell you, the day after, I was fine the day I got my vaccination. This is, I think it was Easter Sunday. I don't remember. It was a couple of Sundays ago. And the next day, like in the middle of the day, right before the show, I started getting a little headachy and tired.
Yeah.
And so I did lay down for maybe less than an hour and I felt okay. But then last night, and listen, I don't know if I know it was a real headache, but it could have been brought, being honest, either by my sinuses, because it was like right up in here, it was in my sinus cavities, or it could have been the news of the J&J vaccine. I got really sick. I got a headache. I was, doubled over with nausea. I took a couple of Tylenol. I went to sleep. I woke up. I was okay.
Well, and that's a good point too. If you take some Tylenol and things get better, then that's not a blood clot condition. But I bet part of that was stress. Muscle tension and stress, sure.
Yeah. And so how long is the pause going to be, Dr. Kelly?
I don't know. That probably not that long. What they need to do is to look at those 6 cases. And when I say look at them, I mean really go into detail into their medical record to look at all the lab results. These people also had CT scans of the head, MRIs, maybe an angiogram, which is a blood X-ray. They put dye in your blood and look at the X-ray. I think that it's going to take several days to go through those with a fine-tooth comb, because they also want to look at the scientific literature to try and find, have there been any other similar cases like this? And, what are the links? And they might want to do some special additional blood tests looking for certain antibodies, because this may be an immune system problem. So I would anticipate it's going to take a few days, but we're not thinking that's going to be longer than that.
And then they'll bring it back on the market. Do you think that then what will happen? They'll say, okay, these people shouldn't take it.
It remains to be seen. I mean, literally this afternoon, right now, CDC is meeting about this and going literally through these charts to make a determination. So they'll have to make a determination, was this vaccine related or was it not? It seems like it's vaccine related, but the other important part is, what is the risk to anybody else? Is this, a rare phenomenon, and these particular people have something special about them? And can we find out what that special something is? And if we can, they've got to weigh the pros and cons of getting, as I mentioned before, you think about how many people have died of COVID, and not just deaths, people who have long COVID, people who have chronic complications, who had permanent damage to heart and lungs. It much greater rate than 1 in a million. Yeah. So, weighing those pros and cons. And what DHEC will do, it will likely follow what CDC is doing. We told the pharmacies and the other vaccine providers who had clinics ready to go with Janssen vaccine, as much as possible, we switched them out so that they could have Moderna vaccine that they could use, and just hold on your Johnson & Johnson vaccine for right now until we know more.
Right. In It Together SC and the Diabetes Advisory Council of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. We're running a little long today because we wanted to talk to Dr. Jane Kelly, Assistant State Epidemiologist, about the J&J vaccine. I just hope, Dr. Kelly, that it doesn't cause more vaccine hesitancy. I mean, there's already a concern, as we just said, with Vince and Leah, among so many demographics of people. And it seems like, though, in the last couple of weeks that vaccines have been going on the upswing. More people have felt more comfortable getting it. So I'm glad that something happened on one end, because if there is a demographic of people that don't need to get this particular one, we need to identify that. But then on the other hand, I hate if it causes people to say, see, I told you so,
Exactly. Well, in fact, I think this is a measure of the system is working, that they found this really rare event shows how sharply they are keeping an eye on things. But I understand people are concerned. I do want to remind people that we've got more than 150 million doses of Pfizer and Moderna that have been given, and we're not seeing that with Pfizer and Moderna. They are manufactured in a different way. Yeah. We are not seeing blood clots or these rare events with Pfizer and Moderna. I mean, certainly people experience symptoms the second, third day after vaccine, that's for sure. Sore arm, maybe a rash, fever, aching all over, but that's for a couple of days. And that's much less than what you would experience if you had the actual disease.
Yeah. Dr. Jane Kelly and her dog, if you can see him in the background. DHEC Assistant Epidemiologist. Shout out to Jane Kelly's dog.
I thought I would put up a screen or something, but I'd rather be a real human being to you.
Yeah, it's all good, girl. Let these dogs look. That's his house, too. I should be able to walk through. So listen, before you leave, the big mass vaccination site of FEMA and DHEC, Columbia Place Mall, Tell us the details. Why was that important to do?
It shows a collaboration between the federal groups, the FEMA, and DHEC. I mean, trying to organize a massive event like this and have it run efficiently. You know, in the very beginning, we were concerned about mass events might turn into super spreader events. You know, people might be gathered in one place and or there would be some slow ups and that would discourage some people. So we wanted to make sure that this was run, you know, like clockwork, as efficiently as possible. In fact, yesterday they sort of had a trial run to make sure that it was going to go. You know, they had a soft launch. But what's extraordinary about this is the cross collaboration. Different people, different skills, organizational skills, vaccine administration skills, you know, having the observers, best use of your volunteers. So that's what makes this extraordinary, that you can reach so many people by coordinating, by collaborating together.
Well, we know it's 7 a.m. to 7 p.m., 7 days a week, Columbia Place Mall. Anyone 16 and over can get vaccinated. You don't have to have an ID. You don't have to make an appointment. You can do drive-through or walk up. And how long is it going to be there, Dr. Kelly?
I think part of that depends upon the number of doses of vaccine that are given. So it's a supply and demand sort of thing. They will be there as long as there are arms to vaccinate.
Great. Well, that'll be great. Columbia Place Mall. Anybody can stop by there. As I said, Monday through Sunday, 7 a.m. to 7 p.m. You don't even have to have an ID, 16 and older. And the other great thing is sign language and Spanish interpreters are on site to translate for you. And it's going to be there. So please stop by. You don't have to have a car. You can walk up and it's going to be going on. FEMA and SCDHEC has collaborated to do this mass event. And as Dr. Kelly said, it'll be there until all arms are vaccinated, as long as people want to come up and get it done. Dr. Kelly, thank you so much just for joining us today. Now, I'm not sure what kind of meeting you were in. Is there something you can update us about?
Oh, it was just a press briefing on the same topic of what's going on with the Janssen vaccine. I guess the other thing that we mentioned about that, you know, trying to put things in perspective is, did you know that people who take birth control pills, blood clots occur among women who take birth control pills at a rate of about 500 to 1,000 women a year. And yet we accept it's important to take birth control. If you don't want to get pregnant, birth control is a very effective method. And so people accept that there's some possible risk. These are treatable things, blood clots. They are recognizable and treatable things. So I want to put that in perspective too. One other statistic I'll give you has to do with smoking. People who are smokers have blood clots at a rate of about 1,700 per million per year.
Wow.
So 6 in a million, I've got to put it in perspective. But I hope people still feel confident about getting vaccinated. Pfizer and Moderna, we've had no problems. The CDC is looking into what's going on with this Johnson & Johnson vaccine right now. We will have more information even as soon as tomorrow.
All right. Well, great. Dr. Jane Kelly, Assistant State Epidemiologist, thank you again so much for joining us today and for always being available and interested in coming on and giving us the information. We appreciate you.
Absolutely. Thank you so much for inviting me.
Absolutely. I'm Trey Taylor, and this is Wellness Wednesday. In It Together SC and the Diabetes Advisory of South Carolina present Wellness Wednesday every Wednesday here on Coping with COVID. Listen, if you have a story or initiative that could help someone cope with COVID, please go to the Tailor-Made Production page on Facebook and inbox me. We would love to feature your story on Coping with COVID. If you have a product or service that could help someone cope with COVID, please email copingwithtreytaylor@gmail.com. And we would love for you to be a proud sponsor, just like all of our sponsors. If we can get up our sponsor logo, you can see SCDHEC ended together, SC, the South Carolina Diabetes Advisory Council, Office, City of Columbia Office of Business Opportunities, Javis Tax Services, Agape Counseling and Training Center, the Comet Bus System, Computers Unique, Dutch Square Mall, and Palmetto Media Connections. Renee Nelson says, thank you for the great information. And for the community knowledge and education. Get vaccinated. Definitely, Renee. Thank you. And Mitchell Peace Joy Jen says, good update. Thank you, ladies, so much for joining us. Spread us out so we can get the message to the masses. Hey, coming up tomorrow, Jamie Suber with the Department of Employment and Workforce. Do you have a question about your unemployment benefits, jobs, your questions and more? Coming up tomorrow with the Chief of Staff and UI Director Jamie Suber with the Department of Employment and Workforce. Faith Friday with Dr. Nicole Edwards, her successful extreme weight loss journey and how you can do the same. And then next week, diabetes and stress right here on Wellness Wednesday with lifestyle coach Ellie Land. And the next Thursday, it's the Divine Listening Session with Columbia mayoral candidate Tamika Isaac Divine. We have a graphic for that. She is going to join us to talk about her run for the mayor for the city of Columbia and what she's got coming up next, some things that she's planning. And if you have a question, please let us know, because we're going to talk to Tamika Isaac Divine. As always, I leave you with a reading. I've been doing a 100 Days of Believing Bigger with Marshawn Evans Daniels. And this says the purpose pathway, God's works. It starts with a scripture, for we are Christ's workmanship, created in Christ Jesus to do good works, which he prepared in advance for us to do. He prepared us to do good works. As we continue to break down the 4 key parts of the scripture above: workmanship, good works, advance, and do, remember that we're delving into the topic of purpose. What's your purpose? Each word is a purpose clue. The next part of the phase, good works. So often we miss the pathway to a higher purpose because we're either looking for something impressive, worthy of praise, or something perfect. We don't want to be a disappointment to God, and we don't want to get it wrong. Here's the thing. Being able to figure out exactly what God wants you to do, where, when, and how, is really an impossible standard. So let's take the pressure off clarity and shift into something better, which is courage. The passage above is filled with permission. You're already created to do good work. So just start there. Start with something, anything that will help people. Eventually, you'll find patterns and clues to guide you into a more focused direction. Whenever you operate with the mission of helping people, know that heaven is with you, covering you, and opening more doors for you. Man, that's good. Here's the prayer. Lord, thank you for reminding me that everything you do has unlimited purpose. Any moment you are present is an incredible gift. Fill me with your heart and mind. Guide my choices. Make me a light. And remind me that good works are part of my spiritual DNA. That is 100 Days of Believing Bigger from Marshawn Evans Daniels. I'm Trey Taylor. Thank you so much for joining us again on Coping with COVID. Until the next time, I wish you peace, abundant blessings. Be safe, stay careful, get vaccinated, do your research, and please wear your mask. Still got to do that over your nose and under your chin. Have a good one.
Coping with COVID and In It Together present Wellness Wednesday, brought to you by the Diabetes Advisory Council of South Carolina and DHEC's Division of Diabetes and Heart Disease Management.
Coping with COVID with Trey Taylor.